Dr. Melvin, maybe explain to us what is GERD and what would patients that are suffering from GERD, what are the symptoms that they would have or the issues that they would be suffering from?
GERD is GERD, gastrointestinal reflux disease. Some people refer to it as heartburn, indigestion. It has several different names. In short, it is an abnormal clearing of the normal reflex process. So we have, as normal every day, everyone has some degree of reflux. Generally, we have a normal valve mechanism which acts as a one-way valve, and we have things like our saliva and standing and swallowing that help to flush out that reflux. It becomes pathologic when that reflux happens too often, doesn't get cleared, or the valve mechanism is abnormal.
Yeah, thank you. And George, maybe you can explain a little bit, when did you first start having symptoms and what kind of symptoms did you experience?
I had started having symptoms about 2 years ago, and it was pretty much feeling some pressure and acid reflux in the chest, getting heartburn. One of the things that I had also experienced was I had I felt like a metallic taste in my mouth, which is wasn't sure if that had something to do with GERD or not, but it was it was through that whole time. I was also having to take medicine to keep the heartburn and the gas and that down. So it just kept getting worse, and so went to see Dr. Melvin.
Okay. And the medication you were talking about, was it just the prescribed medication or just kind of over-the-counter medication that you were taking?
It was prescribed. It was Nexium, PPI.
Okay. And then did you get to a point where you just continued to take more and more helping with the symptoms that you were having?
It sort of made the symptoms less, but the symptoms never went away. They would just keep coming back. I tried to actually stop the medication a few times, and immediately I would get the same symptoms right back.
Yeah, is that pretty typical, Dr. Melvin? If people try to stop their medications, all of the symptoms just come straight back? What do you normally see?
Well, it depends. Sometimes there can be one event that causes a real severe episode of reflux, and then once you control that immediate or single event, then things can kind of go back to normal. For those people who do have an abnormal valve or an inability to clear, then as soon as they stop the medicine that's adjusting the acid, their symptoms can return. Or in George's case, they never really went away, they just slightly improved.